Hi, everyone. Welcome to Pet's Best Friend with my good friend, Dr. Anaya Cathio. Another great show for you today. You're going to learn a lot about veterinarian medicine as well as some of the animals that Doctor has on the show. Good doctor, how are you?
Thank you very much, Sam.
Are you behaving?
Trying to behave myself, yeah.
You know, I got to tell you, I was looking at some of the older shows we've done. You know, how many years are we doing this? 10, 12? 12?
15 years.
50?
Over 15,
oh, my
over
goodness,
15
yeah.
years.
And I still look the same, and you still look the same.
Right.
No, I was looking at some of the shows we've done, okay, and it's amazing. You know, we could take some of those shows and run them again because all the stuff that you talked about with animals is, you know, just as current as they were then.
Exactly, you know, and we've been doing so many different things and showing different things at a time, and we can, if somebody can go and watch our show, they will be able to get a degree and practice.
You know,
practice medicine.
And it's on the website, folks. As you know, you can go on our website, and we have all the shows there. But again, today we're going to be talking about some of the animals that you worked on. All right, and hopefully we could, you know, get a good message. And then a little later on, I want to talk about your console, which I think is really a fantastic thing. But let's talk about what we're looking at right now. We got a bird and then some other animals. So whenever you're ready, you can tell Andy to start doing what he has to do. In fact, there's the bird right there.
Okay, I will start with the bird. Sam, what happens that there are many people, they bring the bird in, they think that their bird will never ever get sick, and they think we're going to live for a long time without any problem or something. When the bird gets sick, it is very difficult, you know, to give them a medication. But what I suggest and what I find out when the people bring the bird in, and I tell them to start giving them some juice in the syringes. So God forbid if they get sick, they will be able to receive a medication mixed in a syringe and given it to them, and that way the job becomes very easier. Otherwise, when the bird gets sick and a syringe is coming to them, and then they think there's some object is coming to them to harm them, so they do not accept the medication very easily. Because most of the medications, you know, they are in a capsule form, they are in the tablet form, and you cannot pop a pill into the bird like you do in the dogs and cats.
So what you're showing how?
See, if this bird is being trained, you know, to take a medicine, when he gets sick, actually, he's getting he was given a juice.
Yeah.
He was given a juice. Then the tablet was crushed and mixed in the syringe and given it to him. He accepts it very easily.
Yeah.
Otherwise, people have to fight to give medication to a sick bird. This bird has a bacterial infection.
Okay.
Yeah.
Now, how do they know it was a sick?
It's very good. You know, like when the bird gets sick, they get quiet. They get a fluff feather. They don't move around, or they are just sitting on the bottom of the cage, or they are not eating. They're not drinking. So at once the owner notices that something is wrong with the bird and they bring it down to us. Then we examine them. The bird's examination is a little bit different than dogs and cats, you know. Handling the bird sometime can cause the death of a bird. Like a parakeet, you know, like their heart rate is so fast, hundreds of beats per minute. But when you handle them and they get scared and double up their heart rate and they just collapse and they just die in your hands. So you have to be very careful holding the birds.
All right, now the next animal we're going to see here is a cat. And this cat, you said, is blind, right?
Yeah, you can look. It's a dilated pupil. The cat went blind, and we have to bring this wrist. We have to make this cat see again. You can look at the cat. She doesn't know where she is. You can see she cannot see what's going on in front of her eye. What has happened actually that people had given them a medication for the horse to the cat. And the idea was to give that medication to the cat because the cat had a parasite. The horse medication is so much concentrated, and when you give that even small amount of the cat, and it makes him poison, so that the cat got like a neurotoxin. The nerve conduction system failed, and when the cat sees the image, that would not transmit to the brain, so the cat was blind. And I treated the cat, and because I know, you know, what was the organ of a target and where to look for it, and A few days later, I was able to bring the cat back. I was able to give sight to the cat.
Oh, so the
It's
cat got- so that he's-
now you can see the cat is.
I was going to say, if he's
yeah.
blind, I see him running.
Yeah.
Oh, okay.
Yeah,
so
now
you brought his
just-
sight back.
You brought the sight back. You know,
Ah,
now
fabulous.
she can see. And before, as you saw in the front, I was putting the
Yeah,
finger
you
in
could
front
see
of,
it.
could not see.
So
So
you were able to give him a medication or something, and,
medication
and monitor
bring
that.
yeah, and bring the sight back for the cat.
Fantastic,
Cat, you know.
fantastic.
Yeah.
Okay, now here's an interesting thing. Here's a dog, folks. Tell me about this dog.
Okay, they look at the dog has a swollen neck. There could be number of causes of the swelling of the neck in the dog. This particular dog, when you look at it, look at the neck, it looks like a very aggravating swelling and painful edematous, cellulitis, and all kind of inflammatory reaction is taking in the place. When the history was asked if this animal was any injury or any trauma or any bites, yes, this dog was bitten by a dog, some other animal, and injury was healed over. The bacteria got under the skin and start damaging soft tissue. And when the tissue was being damaged, it was turning into a pus. And you can see those bite marks. These are the bite marks. This animal was bitten. Now look at it. What's coming out from the animal is a pus that is a dead tissue and body reaction and the fluids. And after the surgery, you can see he's back to normal. He does not look like a pot-belly pig, but he's looking like a little
Wow.
Chihuahua dog.
Wow.
And the tongue is hanging. He was born like that. It's genetic and a genetic defect.
So you said this dog was bit by another dog or something else?
It's another dog, and see you can see how good he looks. See
Oh,
what
okay.
what happens that when the animal is bit by another animal, especially the cats are their mouth has so many bad germs or something. People should do, like a wash with the soap and water and put peroxide or something. But if the injury is deeper, they should go to a veterinarian, because now that the bacteria has gone inside and it has the environment to breed in there and damage more tissue in there. And sometime the people will think it will go away or not, but if they wait few days, even like 48 hours, you will see start changing redness, streaks, and then swelling, and all of a sudden it gets so big because body is reacting to that bacteria, wants to get rid of it, and so the whole reaction starts damaging the soft tissue. So you have quite a damage, and then we have to perform a surgical procedure to drain the pus, remove the dead tissue and all those things to get them better. It looks very simple on the television, but it took
There's a
some.
lot, yeah.
There's a lot of things that I don't. There are a lot of things that takes place where I don't want to show you to the people because there are graphic pictures and all those things. Yeah,
Folks,
the whole idea is like when there's a bite of animal, a bite to the animal, they should go to the veterinarian and stop, getting a treatment, because it's cheaper and it's easier on the dog. So it's easier on the pocket as well, Then so we don't have to do the radical surgery, and you have so much expenses and put animal through so many problems.
Folks, I'm talking to Dr. Anaya Cathio. It's called Pet's Best Friend. We've been on for 15 years. I can't believe it. It's amazing. If you'd like to contact Dr. Cathio, there's two numbers here. He has a Wilkes-Barre Veterinarian Hospital and also Pittston Animal Hospital. And the numbers are 570-655-2412. That's 570-655-2412 or 570-821-9390 for Wilkes-Barre. We'll be back right after these messages. Stay with us. Welcome back to Pet's Best Friend with Dr. Anaya Cathio, folks. And remember, the phone number to get the good doctor is 570-655-2412. That's in the Pittston Animal Hospital. Wilkes-Barre Animal Hospital is 570-821-9390. And today, folks, we're showing you some animals that he has seen and taken care of. Now, the first segment, Doc, we showed the bird, the blind cat, and the swollen neck with the dog. Now, we have three more interesting subject matters, okay?
Yeah.
The first one here is seizures,
Okay,
right?
Okay, yeah. Seizures, there are multiple causes of seizures. The seizures can happen in the younger age, and seizure can happen in the older age. In the younger age, usually it is due to a defect in the body. What happens? These animals have a shunt. What is shunt? It's the blood vessel that does not pass through the proper channel. It bypasses the proper channel, and the unpurified blood, when it hits the brain, it causes the seizure activity. What I'm showing you here is a dog. I think that film will start it a little bit earlier before I get into it or something, so that we have some technical things, and if we can play back again so I can explain you what exactly we are looking at it. In this dog, what's happening that there's an extra, there's a blood vessel that is not, here you go. See, this is the blood flow that is bypassing the liver. It's not going through the liver into the heart. Now, so what will happen, we'll put a little ring and block that bypass of a blood, because the blood flow is not going through the liver. This is the ring we put on the shunt. That is a blood vessel that is bypassing the liver. And now that the shunt is placed, now you can see the direction of the blood. It's going through the liver into the heart. So these dogs are born with what we call liver shunts. And sometimes the breed is, there are some specific breeds. Like in this case, this is the Yorkshire Terrier. It's very common in the Yorkshire Terrier to develop these liver shunts. And you can see this dog was taking violent seizures before, and after placing that little ring on the shunt and blocking the blood flow going the wrong way, and just allowing the blood flow to go through the proper path. Once you fix the path, animals are back to normal. So in this case, the seizure were related to the liver shunt, and it happens usually in the younger age. It can happen in any time, but in the older ages, usually these are tumors or epilepsy or some poisonings, and there are 99 other causes for the seizures and 100 causes unknown.
Wow.
So the seizure we see, it's uncommon. We see them in our veterinary practice.
Now, the next dog we're going to see, folks, we keep telling you about taking care of your animals, all right, and making sure that they're groomed and making sure that their teeth are taken care of. Well, Doc, what do we have here? Disgusting, really.
The animal teeth should be cleaned every 6 months. And if you don't clean your animals, you can see they develop pus pockets, and these animals stop eating. Not only that the bad teeth have a bad breath, but you can see bad teeth communicate with the gum. That is a heavy supply of the blood.
Wow.
And the bacteria, again, they enter into the bloodstream. It can damage the liver, it can damage the heart, and it can damage the thing. This dog had come to our hospital, as you saw before, with the closed eye and swollen face. And after we drained the abscess and cleaned the teeth, now the dog appears like very normal. You can see that the teeth have been cleaned. And once we remove the pus and clean the teeth or something, the dog has been doing very well. These animals should have teeth cleaned every 6 months.
Well, shouldn't you also brush your teeth,
If
Doc?
you can do that, you should start when the dogs are puppies, so
Yeah.
they learn. But in a dog, when you're old dogs, you see, it's very hard to
Well, the older ones. But sometimes when you take them to groomers, if you're taking your dog to a groomer.
The groomer do not know the physiology and pathology and medicine and structure, anatomy, and all those things. So they would not know, what kind of problem the dog has and why they have a problem with the dog. Just putting a Band-Aid on the wound, it's not going to help.
I got you. Yeah. Okay. Now, the next animal we're looking at has a communicable disease, correct?
Yeah, communicable disease. There are communicable disease. You can get it from the birds, you can get it from the cats, you can get it from the dogs, you can get it from any kind of animals, monkeys and all those things. This girl has brought this dog down. He was being treated for itch, and they came down to me, and I looked at the dog. When I look at the dog, and I asked her that does she have any problem on her body, and she says yes. She has some rashes on her belly. on her stomach. Because when I looked at the dog's skin closer, and the dog has a specific like lesions, and those lesions I took a sample of it and looked under the microscope. As you see that I took the skin sample to look under the microscope, you can see the little crater there is moving around. Actually, that is mange mite, scabies mange mite, and these are communicable from dog to people.
Ooh.
And this animal lives under the skin. If untreated, it can spread. And you can get these problems you will see in some kennels or some breeders, and some place where the hygienic conditions are not appropriate, or sometimes animal with the low immune system, it's likely to expose to these parasites, and they thrive on the skin of an animal. Then it can be passed on to the people. You can see this girl has the rash is not visible on that television screen, but I'll take a still picture and put arrows onto it, and you can see these are very well pronounced.
She got this from the dog?
From the dog, yeah. She got this. See all the lesions she got from the dog?
Yeah, yeah.
Yeah. And we treated the dog, and within a few weeks, the dog responded pretty well.
Okay.
And the dog went back to normal. And
did she have to take something for a rash?
Yeah, she has to take something for the rash. She went to her doctor. Doctor prescribed her medication for the scabies. And once it is diagnosed, it's easy treatable. It's a treatable. But this dog.
So she brought the dog down because the dog wasn't acting funny, or
the
what?
dog has gone someplace, some other places, and they were treating her for the allergies.
Okay. Oh, I see.
The dog was being treated for the allergies, and dog was treated for the also skin infection.
Okay.
But when I'm being in a feed for so long, when I looked at the dog, there were specific lesions on it. The first lesion I took and put under a microscope, and then find out that the dog had mites and men mites. So the medicine was targeted specifically for this parasite, and within a few days we had good recovery, and within 3-4 weeks we took another samples. They were all negative.
Now, doctor, let me ask you a question, okay? And a lot of people maybe know this, or they do not know this. Do animals, I know it sounds like a stupid question, but do animals feel pain? Sometimes people think that they don't feel the pain because they're not screaming or not barking or meowing or whatever.
Okay. Pain, what causes the pain? You know, the pain, if you have a nervous system, if you have a sensory system in your body, when it is damaged, you have a pain. Now, just like animal cannot smile, so the animal cannot exhibit the pain. And especially, you know, like animals in the wild, when they are injured or sick, they do not want to exhibit weakness, because they exhibit weakness or make a certain gesture, they will be easily eaten up by another animal. So they hide things. Animal hides things. Not all the time they can show pain. And we have seen you have seen the dog's leg was taken off.
Yes.
You saw that one,
Yeah.
and the animal was still wagging his tail.
Yes.
And the dog has a fractured bone. They are still, you know, trying to please you or something.
Yes.
They do feel pain, but they do not always exhibit the pain.
Okay.
Yeah.
Well, again, you know, it's amazing, folks. If you're going to get a pet or you're going to get an animal, make sure you know what you have to do for that animal. Don't let it become, as Dr. Inaya Kathio says, the piece of furniture. If you know you're getting a Bichon, make sure you know what you have to do with the Bichon. If you're getting a cat, make sure you know what to do with the cat. Any animal you get, not for the fancy for your kids for a month or two at Christmas time, and take care of the animals. We'll be back right after this. Thanks for staying with us, folks. Remember, 24/7, SSPTV.com. You can watch any of our shows. This is Pet's Best Friend with Dr. Inaya Kathio. You can call the good doctor at 570-655-2412 or 570-821-9390. Now, as you all know, folks, not only is he an outstanding veterinarian, but he is also a consulate for the Pakistani government. We had a separate show on that. Now, bring us up to date what's happening with your, as being the consulate and working with the United Nations.
Yeah, being a Pakistan consulate, it's my obligation to bring two countries on two countries together and make their relationships very strong, and also promote the trades in like American trade in the Pakistan market and the Pakistan trades in the American markets. I'm working with the Senate, I'm working with the UN, and I'm working with the Pakistan delegates, and trying to make these things happen. And some of the pictures I would show you. This is majority leader, Democratic majority leader, Harry Reid. I'm sure that everybody knows, helping me to strengthen the relations between Pakistan and USA. And I have other senators, they are supporting me. Bob Casey has been very kind. Of course, Rick Santorum was my very much help. Now the Bob Casey is helping me on all aspects, not only on the foreign relations, but on agriculture as well. And this is the senator from the Boston, Massachusetts, and we have a senator from this is also for the New Hampshire, Senator Jean Shine. She's on the Foreign Committee, and she's also on the Armed Forces Committee, and I'm working with her to strengthen the U.S.-Pakistan relationship, and we will go to United Nations. You can see this is our United Nations mission in Pakistan, United Nations mission in New York. Behind you will see our UN flag. That's the flag that brought me to this country. I'm very thankful to United Nations. Because of the new United Nations, I'm here in America. And these are the diplomats, Pakistani diplomats, and you can notice something very interesting. This mission is in New York. In New York, you cannot smoke cigars in the buildings, but because this is a Pakistani soil and UN soil, so I had the opportunity to enjoy my cigar while I'm doing the hard work there. And this is our foreign minister's top foreign advisor, foreign and security advisor, Sartaj Aziz. So very close to the Prime Minister Mohammad Nawaz Sharif. I had a dinner with the Prime Minister of Pakistan in New York. And so you're looking over, and this is our Minister for the energy. Pakistan needs a great energy. I'm looking into Pennsylvania, because Pennsylvania has a tremendous amount of energy available in the form of like gas, solar energy, and and next to it is also another Prime Minister said, this is our Foreign Secretary, Jalil Abbas Jilani. We said this is the counterpart of Senator Kerry, and this is the counterpart for our Pakistan, like Senator counterpart for the John Kerry. This is our counterpart in Pakistan.
And what you're doing is extremely valuable. I know Representative Toohill is working with you in trying to get more commerce into the state of Pennsylvania.
Yes.
Because it's wide open there. And how do you find the time to do this?
You always, if you have a will, you always have a point to do that.
That's why you work 24 hours a day. Well, once again, we're very proud of you, Doctor, because you're doing a lot of humanitarian work, and there's a lot of work that people know that really do not know that you do. A lot of bono work, pro bono work for a lot of people, and you're very helpful, particularly. But your main objective's always been for the protection of animals.
Protection of animals, yeah.
And you work with the SPCA, right?
Worldwide.
Worldwide.
Worldwide, yeah.
Dr. Inayat Katyal, folks, it's Pet's Best Friend, and we've been on for over 15 years. I can't believe it. It's the number to get him is 570-655-2412 or 570-821-9390. He's there for you. Give him a call if you need him. We'll see you next time on Pet's Best Friend.